last year. All right, guys. Let's get started quickly. It means very soon enough. So let us hear. What do you have to say? People comment in the comment section. How is it going so far? Only few more days for the end game. Let's see what you have in mind. Anyone? What's up? What is your feedback, Nago? Thanks. That's my feedback. Okay. You're welcome. Someone is so sad with the life, they've just put asterisks. Oh my god, Isaac is green as well. I hope the UG guy knows that this is for PG people. I mean, if you're in UG, you can also be there. Helps you to revise. Let's see. Few more minutes. We'll be starting the quiz soon. Any more feedbacks, guys? I think you guys will love it. Is it? The latecomer is on time. Name, but you're still going offline. Okay. I don't know what the latecomer mean in that then. I know. Soon, guys, soon. Just give us one more minute. And guys, we expect you to just call us doctors. No sir, no ma'am, no nothing. Just call us doctors or doctor. You can call us Dr. Rupal, you can call us Dr. Manoj. UG, you gotta wait. We're waiting for one of our team members. We'll be starting the quiz soon. We'll be starting the quiz at 10:20. So one more minute, okay? Till then, enjoy yourself this music. Are you able to see the screen on YouTube? All right, so it's 10:20. I think we'll get started, okay? All right, just hold on a second. Okay. All right, guys, so we're going to start with the quiz. So thank you all for joining and coming back. Here we go. I hope you're all set. Let's get started. Your first question. A 32-year-old athlete complains of in the medial aspect of the knee after a sudden twisting injury while playing football. Examination reveals tenderness over the upper medial tibia, and Baldwin's stress test is negative. The most likely injured structure is. Alright, so your clue for this is, think of a group of three tendons inserting on medial tibia, resembling a goose foot. Let's see, do you get it? Alright, so as you can see, the time is up. Peace and asterisk is the right answer. Alright, go back to your notes and have a revision for this. What's up? You can skip this one, as you can see. Any of you has left? Okay, and if you're able to answer, then you can answer this again. कर दो भाई, click कर दो to your answer so that at least whoever hasn't It is seriously funny, guys. Come on. Know the answer then also. All right. Now, the UG is doing wonder in PG. Very good. Moving on to your second question, that is, a 40-year-old male presents with difficulty walking after a hip injury. On examination, when he stands on his right leg, his left hip drops. Which nerve is most likely injured? Let's see if we can get this one right. In case you're hoping for a clue, here is it. This nerve supplies the muscles responsible for hip function and exerts the pelvis through the greatest limb above the spinal pelvis. Now let's see if we have got this right. All right, so most of you have got this right, which is great. That is superior gluteal nerve. Very well done.
Rupal, can you switch off the audio? Music.
Music? All right, just a second. Let's move on to your next question, and yeah. All right. Manoj, you can carry on.
Yeah. A 25-year-old male is brought to emergency department after a motorcycle accident. He has a fracture of tibia and complains of severe pain that worsens with passive toe movement. So on examination, his leg is tense and swollen. Distal pulses are present. So what will be the next best step in the management?
All right, all right. So as we know, they're used to the clues, and the clue is the 5 P's are key here. 1 P is the most reliable early sign. Now let's see if we can get that one. So the time is up. Let's see what does it reveal. So most of you have got this right. That is immediate fasciotomy. All right. So guys, as you can see, the competition is tough. Cutthroat competition is present right now, right here, literally in the leaderboards, which is great. Moving on to your fourth question, that is a male presents with continue.
A male presents with pain and swelling in the perineal region after prolonged cycling. So examination reveals tenderness in the perineum, erectile dysfunction, and loss of sensation over penis and scrotum. So which nerve is most likely compressed?
Which nerve is most likely to be compressed is the question. And your clue is this nerve exits the pelvis via the greater sciatic foramen and then re-enters through the lesser sciatic foramen. Let's see, you guys have answered or not. The time is up either way. So, all right. So most of you have got this right. This is a division between you guys. Get back to your anatomy and you. So pudendal nerve is the right answer. Moving on. So as you can see that you have picked up the space. Let's keep moving forward to your fifth question, that is.
Rupal, you can do it.
Okay. A male presents with swelling and pain in the perineum after a fall while standing or railing. Examination shows a tense hematoma over the perineum and scrotum with intact deep perineal fascia. Urine output is normal, but there is blood at the urethral meatus, which space is affected. Last
So
few
if the
questions.
yeah,
Yeah.
if the deep perineal fascia is intact, urine is confined to this space, okay, which lies superficial to the perineal membrane.
Mm-hmm. So that is great. So your answer is superficial perineal pouch, which is the right answer. So that's great going. Moving on, what do we have on the leaderboard here, Manoj?
Okay, we have Myra leading, followed by Naga, late comers, maybe then Aisha, PKS and Bhakia, Dr. Ritztak, Saikas Bain is there, and Shalini, RDT. Oh, NEET UG. How come NEET UG is there?
Exactly, that's what I said. I said, what is the UG doing in PG? But he answered the first question right when no one answered
Hmm.
it right, so which is good.
Okay. RK, Ramakrishna, Karthikeyan.
He's playing twice. एक नहीं तो दूसरा तो सही. All right. So, guys, let's keep up the pace. Moving on to your next question.
Okay, a 55-year-old multiparous woman presents with urinary incontinence and sensation of pelvic heaviness. Examination reveals a prolapsed anterior vaginal wall consistent with a cystocele. So, weakness of which of the following muscles is most likely responsible for her condition?
So, let's go for your clue. Do we give you
I
a
think,
clue?
yeah, no clue is required.
All right. Good. So, great going. Time is up. Perfect. It was an ANAT and OBGY together. So, Levator and I is the right answer. Moving on forward. All right. So, we have established Myra is not a bot. So, to whoever wanted to ask. All right. So great going, guys. Great going. You have picked up the pace. Let's keep moving forward to your seventh question. That is, a 30-year-old male is brought to the emergency department after a RTA. He has a pelvic fracture, blood at the urethral meatus, and is unable to pass urine. A digital rectal exam reveals a high riding prostate. Which of the following parts of the urethra is most likely injured?
So this part of urethra is most commonly included, okay, in pelvic fracture and is located above the perineal membrane. You see, pelvic fractures are very important. Pelvic injuries.
Favorite question for NEET.
Yeah.
All right, guys. So the time is up. Let's see what do we have. Correct. It is membranous urethra, and most of you have got this right, which is great. Moving on. Let's keep moving forward since we're reaching to the end. Your eighth question, that is.
A 50-year-old male presents with hoarseness of voice after undergoing aortic arch surgery. Which of the following structures was most likely injured during the procedure?
Right. All right. So this nerve loops are under the aortic arch and supplies intrinsic laryngeal muscle, except one. Ugh, I gave you the biggest clue.
I think, uh,
Right, right.
yeah, instead of asking which nerve goes or winds around the aortic arch, they might give a clinical question like this.
Hmm. Point. But usually when it comes to anatomy, they try to keep it a little straight.
Hmm.
All right. So with the clue or without the clue, we won't know. But you have got this right, which is great. So left recurrent laryngeal nerve is the right answer. Moving on. So we have Naga also, who is having the longest tree, which is great. And Myra is on leading the leaderboard with late Karma Navy, followed by Aditi, Aisha, Naga. All right, Naga on the fifth. Great. All right, guys. To your second last question for tonight's quiz. A 40-year-old male presents with difficulty breathing and shoulder pain after undergoing abdominal surgery. A chest X-ray shows an elevated right diaphragm. Which of the following nerves is most likely injured?
So to give a clue, this nerve originates from C3, C5, which provides motor innervation to diaphragm.
You can say it finds like a referred pain in
Right.
the shoulder.
Yeah, this is the main supply with nerves which supplies the diaphragm.
That's point.
The hiccup nerve.
Hiccup nerve. Yes. I hope now they have got this right. Phrenic nerve. Very well done. All right, guys, let's not see that. Moving on to your last question for tonight.
Okay, a patient with a history of chronic aspiration pneumonia presents with persistent lung infection, which is localized to the right lower lobe. A bronchoscopy reveals purulent secretion in the bronchus supplying the superior segment of the right lower lobe. In which position is this segment more prone to aspiration?
All right, fluke coming up. That is, gravity plays a role. Think about how secretions settle in the lungs when a patient is lying flat on their back.
You gave the answer.
No, I didn't.
You did actually. Lying flat on the back.
Uh, I was trying to trick them until and unless. All right, guys. So that is great. Supine position is the right answer. And here we are with the end of today's quiz. Let's see what do we have here. Congratulations, Myra. You are the winner for tonight's quiz.
Yeah, congrats and see the emoji there. A nerd emoji.
And Scooter,
Congrats, guys.
nerd from Encore. All right, guys. So this is applause for you. You're doing great. All right. You're welcome, Myra. She's on YouTube. She's texted. Nice question, guys, with a fire emoji. So we are happy to.
Oh. Yeah, we are happy to see you every day.
Yeah.
Hope we all get a good rank, good seat.
Yep. That is what we wish for. All right. So that brings us to end of the quiz, guys. So see you tomorrow, and be prepared. Anatomy is still on.
Yeah. Till then, one more day for Anat. I think, yeah, tomorrow is the last, right?
Tomorrow, no, 2 more days.
Two more
One,
days.
yeah, lower, and then grand finale.
Okay.
All right, guys,
Okay.
keep revising. Okay, wait, we have a person, a dog is saying on YouTube that it would be helpful if explanation only for difficult questions given in future quizzes. All right, so let me address this. Sometimes there are few questions which are difficult for few people, and it is not difficult for other people. And yeah, so we won't be knowing. So if in case you find any questions or anything difficult like that, come to the Telegram group and just let us know over there. So we'll help you out over there. I hope this way it just helps you and doesn't keep you along waited. All right. So
Yeah, you can do that.
yeah, because if we add everything over here right now, it will. You guys won't be able to, be in a quick hurry. It's a question round. That's it. All right, guys. So anything else that you would guys like to say or would like us to know? All right. So let's call it a night. See you tomorrow. Good night. All right. Be online.